me? Thank you, Dr. Deepamala, and thank you, Sahani sir. And Doctor, it was an excellent presentation. I heard Dr. Arpana, but now we are very much thankful to you. And now we are going to our English session. This is our good morning, good afternoon, good evening to all. Today is our 1452nd day of our IFPH meeting, International Forum for Promoting Homeopathy, conducting all these days, throughout all these days, we are conducting these programs. Now, we welcome all of you. Let us have an 1 minute silent prayer before starting the session. Thank you all. Today, our English session is Dr. TANZILA KHALIQ from Pakistan, BHMS, DHMS. She is regularly doing classes conducting classes here. She is an eminent personality in Pakistan, our dear country. Dr. TANZILA, Pakistan. The first lady homeopath practicing on mind method in Pakistan. So it's radar opus and dynamic repertory. Written a lot of articles in various magazines and daily rubric international article post from Pakistan. She is running an academy by name and teaching basis of Segal method and classical method and single remedy practice. Online Homeo Skill Academy with Dr. Javed Akhtar. Now, today she's she's going to talk about enlarged lymphatic glands in leukemia and solved by a single remedy. We know that lymphatic system always affecting in cancerous conditions. When this cancer is traveling from one part to another part through our lymphatic system. If it is much more affected, it may lead to serious consequences. I think that she is present there. Please raise your hand. I cannot see you, doctor. Okay, I shall make you.
Hello, assalamu alaikum, namaskar, and good evening.
Okay, doctor. Good evening. We cannot see
Thank
you.
you. Thank you,
Can
Dr.
you open
Albert.
the video?
No, sir. Actually, I am in family, so I can't please. I'm not allowed my family. So I'm speaking in front of you and presenting my case.
Okay, doctor, you are
Thank
welcome.
Thank you.
You can start now. You know everything. Okay.
As I was sharing the interesting and important knowledgeful case in front of you, and today also I take the choice the interesting case for all of you. This case of my student of the Homeo Skill Academy, Dr. Jamil. He was a very brilliant student. This case of his son. Yes. Age 7, disease, leukemia, and this case belonged to the son of the Dr. Jamil, which is student of the Homeo Skill Academy, and who belonged to the Kasur city. One day I received a call from the Dr. Jamil. He says, that I am worried about my son and told that my son is victim in leukemia And the doctor said chemo is only solution. And many glands swelling have appeared, and neck right-sided lymphatic nodes was swell, and neck is left-sided also started swelling, and armpit and chest are also appearing the rapidly swelling of the glands. So I said, Dr. Jamil, please bring the children once, and the couple brought the boy to my clinic that very next day. So I observed the children movements and behavior about 3 hours in my clinic. This very specific time of case taking was a very important moment of the children and parents dialogue in front of me. So I was noticed everything of the children and father dialogue. All details are taken from the parents, and the mother gave me detail from a birth till now. The child never got sick in early age, and he was healthy children. He was not a big a serious disease in the history, because they are all without tension life, without depression and easy life they passed, except he had a little fever in a childhood, but he was not took the rest mode during the fever. Mother says that sibling beats them, changing the mood during the disease, and in this is a disposition basically. He was not an, in this normal condition was very good and polite, kind. But now in during disease, he was irritated, and he does not like the brother and sister. So he beats them, anger them, and always angry mood. Father said, when I come back to the village, and patient children complained of headache. The parents said that in normal condition, the child was a very good morals and sensitive to his sibling. He is also misbehaving with the father, and during the case taking, he was also having the strict attitude with the father. But the father was answering him very kindly and explaining while he was talking to the father in the threatening tone. This behavior seemed very special, and it was mental change in the disease, which is the called reaction. The child did not like to me and did not respond to anything. You can see this situation in this situation. We can see you can observe the movement and conversation among. See this the tone and movement is again observed. See this. This uh, this movement during the case taking was a very important. So I noticed that it was very difficult to understand the case in this in the situation, but it was also difficult to see the sick child. Fever appeared alternative situation with the infections and digestive problems, loss of appetite, and enlarge briskly, rapidly, so in a whole body. Despite receiving so much information, but I was not satisfied. I think that this case should be explored further. How did it get worse? How did the emotional changes take place? So I said, can you give me answer to this? Mother immediately said yes. So I can, since her father has moved away, mother told me about this situation, and mother's observation about the son and father. So she says that father has moved away for job in other city. Since then, her uncle and auntie, which a new married couple, and their behavior is a very strict with my children. Many times she pushes the children out of the room. So he is the his father is the owner of the house. Dr. Jamil is the owner of the house, but he was never abused anyone. So no complaint. He has never behaved badly. So in his house, everyone loves each other. So, but since auntie came and that the atmosphere of the house has been changed. Mother says, my son remembers his father and says on the phone, so Baba, come to home, and Baba come to home. So as soon as mother told this, I felt that I think this is the cause of the disease. I says, yes. I was sure that I got the point. Now I was fully confident, so selected the remedy. This is analysis of the case when I got the complete situation from the parents. So I selected the rubric anger children in attached father children are attached. The boy there is yes anger children in attached father children are attached to the boy. Foolish behavior, extravagance, ailments, anger, silent grief. With actually, I took this rubric ailments from anger, silent grief is because children was uh, involved in the grief basically because when his father was not in the home and behavior of the auntie and uncle uh, was the make the trouble in the house and make the hurt the all children in home. So this is the cause of the little cause of the disease. So his children was missed his baba because he felt the alone in his house, and this is the adaptation of the case and a very strong adaptation of the case. He was not shared his complaints, and he was not shared inner emotions to his mom and dadu. I this called the silent grief, and all uh, lymphatic glands was the swollen. We can see there. This this is the situation. Yes, it was the starting situation basically. So when enlarged the lymphatic gland, so it was very painful, and fever was appear during the all process of the enlarged lymphatic glands. So he was foolish behavior to his father, and we took the extravagance because extravagance means something extra. After after uh, after took the belladonna 60, some doses changed the situation of this case, and children involved in the new situation. Belladonna work is a very beneficially. All inner toxinations appeared on the skin. So a great change in the disease began to occur. The patient's body began to appear pimple of the pustules, full of the pus on the hand, arm, waist, and face. So the same pimples filled with the pus, the hands with the field of the pimple that became a very swollen. Because of this, and become a very swollen, more swollen hands with the pus. We can see there. This is situation, change situation totally. After the even belladonna 6, is all pus formation in inner part of the body and extremities. All of the full with the pus and pustules. Please share. Oh, okay. So there was the full of the filled the pimples with the pus and become a very swollen because of the child also developed a high fever during this condition. Seeing the children in this condition made I was glad when I see that the pus and pus formation and coming out from the body and all toxination leave the body. So I was glad to see that this situation is a very successful. Uh, Now that disease was out of the body and success was in front of me when I see the all this situation. In such a situation, I got the opportunity to change the medicine. The first medicine stopped working. Now belladonna was not working. So and fever was uh, highly fever was 104, and the patient was lost the appetite and fully dullness mentally and physically. I given belladonna more 1 m and 200, but not working. Now I had to think about the something else because the severity of the disease was a very high and change situation. So I think I should make a new analysis and a new thing about the case. Second children was a very state of life and death. Resolve the medication. So fever and pus formation occurred when repeated attacks of the high fever and recovery also continued. Then I felt the case should be re-examined and so this case was the this time where and did not come to the patient was badly infected. I only had one dose of the cyclinum 1 m. Within 2 or 3 hours, the children fever subside and Alhamdulillah, child recovered 50%. It in the end, all parts of the body were pimples, a lot of pus discharge. Now recovery start, and after a lot of discharge of the pus formation, change the blood formation. So fever also uh, it is cleared and recovered, and Alhamdulillah, children was recovered. So I want to share the more pictures. At least change in the situation, pus formation, change in the blood. See, we can see this. Now there is not a pus, there is a blood. And now this is a totally dry. There is no pus and no blood. This was the first medical reports and started recovery. There is the PLT 172 and WBC 3.2 and HB9. So there is started now start the recovery. A lot of pictures have in my documentary, but there is not a selected some few pictures selected. So if you want to any question about this case. In start the case, I was very difficult observation about the case. I asked about the parents, and third time I observed the situation when mother told me, Dr. Jamil is there. Yes,
Yeah, yeah.
Dr.
He's
Jamil
here.
is
I
there.
shall call him. I shall call
Open
him.
the mic, please, Dr. Jamil.
Please unmute. Okay, you can talk now. No, yeah.
Yes, welcome, Dr. Jamil.
Good evening, everyone. Student and member of HS
IFPH.
and a student of Dr. Javed sir and Dr. Thank
Let's talk.
the entire
We can
team
hear.
of IF want to share my experience in this case. Am I audible?
Yeah, yeah, you are audible. You can talk now. Very clearly audible.
Hello.
Hello?
Yes, yes.
Yes, you are. Okay, fine.
Hello.
Yes.
Yes, Dr. Jamil, we are hearing you.
Okay. Son's case, acute lymphoblastic anemia, leukemia. Sorry. Around 4 months ago, and there was a very difficult condition for me to option for allopathic or homeopathic treatment because most of my family members and my colleagues advised me to take treatment like chemotherapy. But when I studied the chemotherapy, I was not satisfied. But there was a lot of pressure from my family and community members. However, I decided to consult homeopathic doctor, and I immediately contacted to my honorable teacher, Dr. Tanzila ma'am, and told her the condition. Dr. Tanzila at that time encouraged me in this regard. She started to treat my son. How she started, she presented all the case in front of you, and the progress has been shared with you by Dr. Tanzila ma'am. It's a beauty of homeopathy, and how Madam Tanzila beautifully take this case and treat the case. So finally, I am very thankful to Master Hanneman, who gave humanity such a great gift in the form of homeopathy. I'm thankful to homeopathy, and from the bottom of my heart, I am grateful to Dr. Tanzila ma'am, who family in these difficult conditions and circumstances, and provide treatment with the utmost effort and dedication. I would also like to express my gratitude to my honorable teacher, Dr. Javed Akhtar, who made a remarkable team of homeopaths in Pakistan. At the end, I am thankful to Allah Almighty who give us success in this case. Thank you, everyone.
Thank you, doctor.
Dr. Jamil. Thank you, sir.
Anybody wants to ask? Yeah, we can see now. Anybody? Hello, Dr.
Why
Jamil. We are very happy to hear from you as a doctor.
Yes.
And shall I present my case? I am a cancer patient, 6.5 years back. Doctors told me, 6 doctors in India, very eminent doctors, told me to remove my half of my mandible. You just imagine that. Cancer of the jaw, and they told me to take out, cut off 25% of my face. That I am due to that cancer and does not having 25% of his face. Losing means what was my condition? 6.5 years completed. I am taking homeopathic medicine. One of my friend is also our, first I started because I know that a doctor does not having a 20 to 25% of losing his face. What will be the condition of the doctor? He has to lie down in his home and do nothing. As a doctor, he cannot practice without 25% of losing my face. So I immediately decided that I am not going to take that condition. Because that time, the doctor who consulted me told me that allopathic doctor, it is a big hospital in India, Kim's Hospital. That doctor told me that you have to remove and the half of my mandible. And again, I went to the RCC. It is an important hospital in India, Regional Cancer Center. They also told me that to remove your half jaw. That time, I know that if I am losing my jaw means I don't have a life. So I take a decision. And one of my friend, he's our treasurer. I used to take homeopathic medicines, and till now there is no complaint. But one of my family members all told me that you don't start treat yourself. You go some other doctor must treat. That time, Anil Kumar, our treasurer of IFPH, he is treating my case and he is treating me. So till now, I don't have anything. No problem. I'm living a happy life. I'm doing all the things, editing and uploading the IFPH meeting, all the things. So these are the things. Today I have a very great, I am also a teacher of music. I'm teaching violin, guitar, and keyboard and everything. Today, my student, day before yesterday, she came to me and told me that I uh, uh, I give a name to Eastern music and Western music. She done today, she got the first place in Western music and third place in violin, third place in Eastern music. So I am very happy because today is a wonderful day for me because this is a very big school in Trivandrum School. St. Mary's School is a big school in the Asia. That girl got 2 prizes, first place in the Western music and third place in Eastern music. These are the things I could do throughout my life. For the last 6 years, I can do several things in my life after here. I had cancer. So, doctors, this is the book, a great book. Dr. L.G. Johns, he treated 20,000 cases of cancer, different types of cases of cancer. He lived in the 18th century. He was a homeopathic doctor in America, a great doctor, L.G. Johns. You can see this book in net. He treated 200 cases, 20,000 cases, various types. So homeopathy do wonderful in cancer cases. So I think that doctor, do not lose your courage to take cases of cancer. I used to take cases of cancers. So I got so many cases I have treated. But I think that it is a great gift of God that given us to treat such cases of where we doctors are treating all the type of cancers. That is what our President Ismail said. Is one of the important doctor, a very eminent doctor. He's treating, he had a IP hospital and he's treating so much cases. So be courageous. Dr. Tanzila, you can start now.
Sir,
You can say.
sir, it's very interesting. Thank you so much. We have a very nice conversation about the cancer and sharing the knowledge. Actually, in this case, I'm sharing a very shortly in front of you, but it was a very long case and have different steps in case. Some people say that we are treating the cancer and giving the only one dose, and I experienced about the leukemia and the thalassemia. Sometimes change the total situation, and now this is a new case for us. So now you should the analysis don't depend the only one remedy. And this is the insist to the patient. Sometimes a total change situation and I was given the 6 belladonna and after they change the total situation and patients the lymphatic gland swelling totally finished and now all body full with the pus and pustules and now full of the burning, high infection and highly fever and now in treatment situation. So when again analyze this situation and selected the syphilis. This is after the 2 months. Given only one dose and patient totally recovered. Dr. Murphy explaining the explain the situation for us and explain the practical part for us. Predicted mind and mixing the symptoms of the layers. Murphy says that and ignoring the etiology. These are all the mistakes and negative matching of the remedy sometimes. So this is the make the complication and create the more complication in the cases. So I experienced the more cancer cases. A patient always hurt from the allopathy. This case was not suppressed. Dr. Jamil was not use the only one injection, even not use the any antibiotic. So this case was not suppressed or and rapidly cured within the 2 and 3 months. Rapidly cure and change the process of this case. So it was a very beautifully and my patient was totally energetic and playing the whole day. He was not involved in the fear and so he was not to do any injection, only one injection. He was totally dependent on home food and 1 or 2 doses and management of the case. So it was purely homeopathy and cure the case. So I always thankful to Master Honeyman. It is a big gift and to the humanity. So we should to take a lot of work for humanity as the being the homeopath. Thank you.
Thank you, Doctor. Anybody wants to ask? Please raise your hands. Nowadays,
Master,
after I think,
Murphy
Okay.
says that this is the major mistake of the homeopathic prescribing, and Master Murphy says that we have the calcaria person sometimes who had the shock that vitality is very lowered, and they get a new susceptibility and involves into the pustula. This can be sudden, gradual, and gradual means iris of the movement that make 6 months as here for the pustula stir are involved. On calcaria gets shock and goes straight into the aconite and a week so later then aconite the there is a shaken up for a week, so they could sleep then this is the very and jumps in every noise, and there is a so someone has the chronic and negative influence, and calcaria is a good confident and raise the family with the so dominating parents, so and puts them down, and they are involved the pustula. If we take the case and we mix the calcaria and pustula into the pustula patient, so if we take the case and we mix pustula and the symptoms together. So this is the very big mistake, mixing of the symptoms of the case. So today I am explaining Murphy's sharing about the case taking. So if we see the cancer case, if when we see the case, if we nervous by self and have no knowledge of the etiology, no knowledge of the management, and actually no knowledge of the case taking. So I think we should not take the case of the cancer.
Dr. Navithavan, please talk. Dr. Yes, just a minute. Dr. Kushnut, you can unmute now. You can unmute now and talk.
I advise my patient totally vegetables, and I advise please leave the all meats, especially chicken, and just only depend on the fruits and vegetables. So I manage the case by food, and I was not given any vitamins, just given the milk and butter and all natural things. So my patient improved day by day, and I have a good in about the mood. He was not anger, and no, was not irritated after some time. Just he was need his baba. So because he was attached to his father, and uh, so he was left the city and come back, join his son. So Dr. Jamil feel that, yeah, this is the problem of my son. So now,
Doctor, somebody asking, Dr. Kushner, please talk.
Yes.
Please
Good
ask your
evening, ma'am.
question.
Good evening, sir. Good evening, sir. It is a very nice achievement, ma'am. Madam, I have a question. Actually, you came to a remedy belladonna. What is the cause behind that, which you retake the case and prescribe the remedy syphilinum in place of belladonna? What was the cause actually?
this is the miasmatic medicine typically, and given the miasmatic remedy, only one dose. When
Pardon, it is not clear. Clear. You talk with close.
yes, belladonna only 6 used as a 6, but syphilinum used in the high potency 1 mg. And at this time, change the position of the case. I was analyzed again because all lymphatic glands was disappeared, and now totally patient is a new formation in front of me. So these two cases in one body, lymphatic glands was totally disappeared, and now change the situation. Patient full of totally all extremities will be full of the pus, and now he was in the highly fever, and this is a new case. Then I was analyzed again, and now a single remedy, syphilinum, and my patient was totally cured. This situation, and spent about 3 months, and rapidly cured. Alhamdulillah, my patient was rapidly cured. So he was not totally lost appetite. He was took the food, fruits, and have the good mood. Because I says to Jamil, please give the time to your son, and leave the job a few days for your son. So son was improved and enjoy with his Baba, change the emotions positively, and now he was feeling with the good feeling, with good emotions, change the positively change in his health. So I shared the totally true all case in front of you, and it was a very risky, because doctors says that the only chemo solution, there is not any other solution. And Jamil is a very respected student, and he says that, ma'am, this is my son, and I believe you. I'm not believe on homeopaths, and death or life is from God. But I believe you, and if death So this is not from you, this is from God. So if heal my son, this is also from God. And we are all praised for his son also. And I appreciate to Dr. Jamil, he was trust on me, and totally depend on me. So it was not easy for me. So in this case, and his elder son was a very precious for all the family. His grandfather and grandmother and mother was a very crying for his health, and now all of the satisfied because Dr. Jamil no need of the hospital visits and no any multivitamins and any antibiotics. No used and totally uh, given the totally minimum doses of the remedy, minimum doses, day and night used the 6 potency, and only third time, third day, every third day given the 1 m potency 3 times. After now feel the fever in these days, so repeated the discipline. So 2 months spent with the belladonna, and after the when new case appeared, then after only 1 month spent with the sick. So my advice to all of you, especially cancer patients, don't depend the only one remedy in 1 month and 2 months and always. I think sometimes state is the change and situation is the change. And sometimes anguish state in the body, but sometimes we need the new analysis of the case. So in cancer, we should to carefully treat the patient because it's a very dangerous situation sometimes. After given the disciplinum, medical reports totally changed. Infections reduced, platelets 172, and going improving everything. HB 6 to 9. So all things are the improving without any allopathy, without any drip. Alhamdulillah.
Now three more minutes. Anybody want to ask? Doctor, it was a very nice presentation and you are always doing wonderful job here. Now I invite Dr. Ganesh to say some words. Doctor, please unmute.
Good evening all, and good evening, Dr. TANZILA. It's really a very good session, though I could not hear every part of your presentation and due to some network problem. Anyway, it's really a great presentation from you. As you rightly point out, we need to look into the case in a detailed way so that we will get the right medicine. And when you choose the right medicine, you can win the case, whether it be a serious one or a simple one. And that's what Dr. Hibbert also told in this presentation, that he also suffered so much of pain and so much of pathetic situation, what to do, where to go, how shall I manage like this. That in those conditions, doctor utilize the friend's help for that. And Dr. Anil Kumar did a wonderful job in bringing Dr. Hibbert back with this beautiful smile on his face. Even after so many years, he is doing such a living and singing lot of songs. Even he sung a beautiful song during our last celebration also. So everything that we achieved is through homeopathy. We can achieve everything through your methodology. The Saigal's methodology really works in a beautiful way in this case also. This shows that those who have still intense desire to win the case can definitely a winner. They can win the case in whatever be the route you play, whether you go with a single method or some combined method, whatever may be. The attitude of the physician is to cure the patient rather than say that this is this and that is that. So I have no way. Anyway, congratulations for such a beautiful presentation. Thank you, Dr.
Thank you, Doctor.
Yeah.
Thank you, Doctor. The next, Dr. Navid, I want to say, you say your words and
Yes.
please say words of thanks.
Hello.
Hello, we can
Hello.
hear, Doctor.
Wonderful achievement. Congratulations to Ma'am Tanzila for presenting very nice case at this platform with wonderful exit. Take the case to recovery. Take the beautiful rubric, especially having the keen of. So,
Thank you, Doctor. It is not audible. Now we are passing to our Malayalam session. Thank you, Dr. TANZILA Khan, and let us go to our
Thank
Malayalam
you.
session. I invite, thank you very much,
to all
Dr.
of you.
TANZILA, and you are welcome to always to our platform. Now I invite Dr. Shaila P. Dr. P. Shaila to do our Malayalam session.